Hello, everyone. Welcome to another episode of the Anti-Pharmacist podcast. I hope you had a nice and enjoyable weekend. Mine was quite busy, but then we moved. It's a new week, so we should start it with positive energy, which is what I'm wishing you guys. I hope that this Monday sets a good tone for your week, okay? So what am I discussing with you today? This is a kind of serious issue. Let me put it that way because, well, it is serious and it is a social issue. This condition can give your ego a good beating, okay, if you're not careful. It is something that affects self-confidence, okay, and it's something that can be controlled, it's something that can be prevented, it is something that can be treated. So not to worry. I am talking about halitosis, okay, that's the medical name, but it is commonly known as bad breath. Bad breath, guys, it is no joke. And funny enough, about 25% of the world population experiences this. Imagine 1 in 4 people. So it's not restricted to particular people or particular races or no, because I know that there are certain beliefs about particular people that, oh, people from this side, they have bad breath. Well, even if you're not from there, you could, and I'll tell you why you're thinking people from those sides actually have the breath, okay? You will discover a lot today if you stay with me right till the end of this episode. Walk with me. So without further ado, let's get right into it. Have you ever walked into a nice setting, maybe a business seminar or a get-together? You're nicely dressed, you are prepared to have fun and meet new people. You go in there with high expectations, prepared to have a good time. Then you get there, you see nice people as nicely dressed as yourself, oozing confidence, and somebody walks up to you. The gender doesn't matter now, wanting to strike a conversation with you, right? And the minute they open their mouth to talk, you just recoil. Have you experienced it before? That reflex action when that odor comes out at you. Yes, what caused that? Bad breath. It could also be you. The reverse could be the case, in which you open your mouth to talk to people and they kind of just shift back a little. You see a change in their attitude and you're wondering why. Well, it could just be a case of bad breath, amongst other things, right? But bad breath is one of the causes of those kind of things, which is why it is important for us to discuss it so that we'll have cleaner, fresher air and better relationships. What do you think? Okay, so what is bad breath? By definition, it is the production of unpleasant odors from the oral cavity, meaning the mouth, of course. Like I said earlier, a whopping 25% of the world population suffers from this condition. That is, 1 in 4 people you meet will most likely have bad breath. How bad is that? It is something that has to be addressed fast, okay? But before we get to addressing it, let's understand it. Let's know the causes. Let's know the types. Did you know that there are different types of halitosis? Yes. Of course, different odors come out from different mouths, but that's not what I'm talking about. There are different types based on the causes. So there are basically 3 types of halitosis. There's the physiologic halitosis, that is morning breath. That's bad breath that comes from, having your mouth closed for hours overnight, which happens to mostly everybody. Okay, when you wake up in the morning before brushing your teeth, of course you have bad breath. Your mouth has been closed for hours without lubrication, without drinking water, so you will have bad breath. So don't expect that you walk out in the morning just after waking up and talk to people and not expect them to step back. That is the normal, in quote, kind of halitosis. Then there's the pathologic halitosis, which is caused by different conditions, okay? Pathologic conditions like diseases of the mouth, of other places in the body, okay? And then there is pseudo halitosis, which means this feeling of having bad breath, psychological feeling of having bad breath even when you do not. You are always conscious, thinking that, oh, I might be having bad breath. Every minute you're smelling your breath before talking to people. It's just a psychological condition in which you have a feeling that you might have bad breath when in fact you do not. Did you know that there is a condition called halitophobia? That is the fear of having bad breath. You want to walk up and talk to somebody, or your confidence is not there. You are not feeling really confident because you are scared that you might have bad breath. A lot of people kind of have that. That's why you see some people, they cannot do without chewing gums. Even when they do not have bad breath, they believe that, oh, before I can talk to this girl or this guy or this person, let me go and chew gum first. Well, they might just have halitophobia. I am not saying that everybody that chews gum has halitophobia, okay? There are some that actually chew the gum because they do have halitosis. But I'm just saying that there is a condition called halitophobia in which somebody has the fear of having bad breath, okay? Yes. So having said that, let's look at the causes of halitosis. The most common cause of halitosis is poor oral hygiene. It's as simple as that. When you neglect your mouth, your teeth, you don't brush well enough or as frequently as you should, you do not floss, okay, you eat just anything, and you neglect your dental checks, you do not visit your dentist as often as you should, definitely halitosis will result. Why? Because bacteria, harmful ones, will start growing in your oral cavity, in your teeth, and it results to bad breath. That's number one, okay? Another one is dry mouth. A lot of people experience this due to different conditions, okay? Inadequate production of saliva. I know that there's this belief that it's saliva that smells in the mouth, but this is actually not the case. The saliva helps you to lubricate the mouth, okay? To digest foods that you take, to even trap some bacteria in the mouth. So if your mouth is dry without enough saliva, then you're prone to having halitosis. Another thing is medications. There are some certain medications that if you take, you will have bad breath because some of them cause dry mouth. The likes of some diuretics, some antihistamines, okay, some antidepressants, antipsychotic, there are lots of them. Let me not bore you with the classification or even the names, because I don't want to call names of drugs now and you now say, since this drug can give me bad breath, that's another excuse for you not to take it. No. And for those that use inhalers, asthmatic patients, always endeavor to rinse your mouth with water after using your inhalers or even your discus, okay? Because those tend to cause dry mouth, which in turn could cause bad breath, okay? So if you notice that you take a particular medication and it gives you some certain breath, you can talk to your healthcare provider. Of course, that is my number one go-to solution. Talk to them, they'll guide you on what to do. If you have to change it, fine. If not, just take enough water. Make sure your mouth is always lubricated and you'll be fine, okay? Yes. Another thing is there are certain health conditions that cause bad breath. There's diabetes, okay? Especially when your diabetes isn't controlled, it could lead to a condition called diabetic ketoacidosis, and one of the symptoms is a kind of breath called cosmal breath. It will be like sweet, fruity breath, but after a while it could become offensive. You don't know the kind of breath that would be offensive to some people, no matter how fruity we call it, right? So please make sure that you keep your blood sugar in check. There is gastroesophageal reflux disease, that one that when you eat you start belching. Yes, so that's another cause of halitosis. Of course, gum disease, gingivitis, in which your gum is swollen because there's bacteria present there. Yes, there is infection of the ear, the nose and the throat. As long as there's harmful bacteria in your oral pharyngeal cavity, your oral cavity, your buccal cavity, whatever you choose to call it, then you might develop halitosis, okay? Then oropharyngeal cancers, anything that causes the normal physiology and anatomy of your mouth or the oral cavity to change can lead to bad breath actually. The liver and kidney disease can also lead to halitosis. You know, the liver and the kidney, they are organs of detoxification, metabolism. They remove harmful substances from your body. If these organs are diseased, they do not perform at the optimal, and some harmful substances can remain in your body, leading to physiological changes, can lead to dry mouth, could lead to reflux and all of that, could lead to halitosis, bad breath. And there's an autoimmune disease called Sjogren disease, which causes muscle pain, dry mouth. It's just like the body fighting itself, resulting to all of this. It could also lead to bad breath. Okay, so when you see somebody that has bad breath, do not be so quick to judge them that this person is dirty, their oral hygiene is bad. No, it could be due to the medication they're taking, it could be due to a health condition, it could be due to autoimmune disease. But lastly, food causes dry mouth, food causes bad breath. Okay, watch the kinds of food that you eat, and even if you eat them, remember flossing, brushing. Okay, who says that you have to brush once or twice in a day only? If you eat something that will give you a kind of breath that is not normal, you could just brush immediately after eating it, or find a gum to chew. A sugar-free gum is most recommended, okay, because sugar itself can lead to accumulation of bacteria. You know that, right? Yeah, and there are many good sugar-free gums. So the kinds of food that you could eat to give you bad breath, I don't have to tell you, you know this: garlic, onions, fish, spicy food, some kinds of fruits, you know them. Okay, so I'm not saying avoid them altogether. If you have to eat them, don't eat too much of them. You know, our teeth have holes, they could just get stuck there and start growing bacteria, giving you bad breath on the long term. But that short term that you've eaten it, please always have a dental floss. I think in Nigeria, I can't speak for other parts of the world, but I don't think we take our dental health as seriously as people outside. Okay, I say this because you see them taking their children for dental checks periodically. Even the adults go, even when they don't have any issues. It's lately now that people see that they could wear braces for crooked teeth, that people are now visiting dentists. That's not the only use for dentists, guys. That's not the only things they do. You could do your dental checks every 6 months or even once a year. You could do your dental cleanings, okay, dental polishing. Go do dental checks generally. Okay, it's not until you have that toothache that you should visit your dentist. It's not until people start complaining about your bad breath or you start feeling less confident that you should go and see your dentist. It's not until you say that, oh, people are complaining about my crooked teeth, let me see if I can wear braces. I know braces have become suddenly in fashion. Before, people used to shy away from it, but now people are embracing it, and it's a fine thing. But that should not be your only reason for visiting your dentist. Okay, it will pay you in the long run to do those periodic dental checks. It could just save you from social embarrassment and improve your confidence. Okay, now that we know the causes of bad breath, let's look at the prevention. I've kind of mentioned them in the causes, right? But let's look at them in depth again. So the first tip to prevent bad breath is to brush regularly, twice a day. Okay, I know that we do not really adhere to that, most of us in this country. Like, why should I bother myself to brush twice a day? But please try it. Your breath, your teeth, everything will be all the better for it. Brush twice a day, okay, and at least 2 minutes each time. Make sure that you get a good toothpaste, a toothbrush that is not too hard, so that you don't injure yourself, you don't injure your gums and give yourself gingivitis, which in fact can cause bad breath again. I hope you get me. Yes, and brush your tongue. When you are brushing, don't just focus on your teeth alone. Brush your tongue, okay, because there are things that coat the tongue as well that could give you bad breath. There could be residues from the food you have eaten throughout the day, and that could give you bad breath. So brush your tongues, guys. Okay, that's number one. Number two, stay away from smoking, tobacco, it gives bad breath. Apart from the fact that it causes dry mouth, which in turn causes bad breath, even the smell of tobacco itself is not pleasant. So that is bad breath on its own. Okay, stay away also or reduce caffeine consumption. Okay, tobacco, smoking, all of that, they give bad breath, guys. Yes, another tip to prevent bad breath is flossing. I can't stress it enough. Floss, have dental flosses. Okay, when you eat fruits like oranges now, you see they are stuck in your teeth. You think you can use your tongue to remove them. You know how we do that, we use our tongues and place them in between our teeth. That's not enough. You may not remove everything. When you eat your rice, you eat your meat, those things get stuck in between the teeth. Let's develop a habit of flossing, okay, so that the space between our teeth are well clean, because sometimes in our rush in the mornings we do not even take care to clean the spaces very well. We just do shuku shuku shuku. You know how that thing goes, that children do, some adults still do it, and at the end of the day you'll be wondering that maybe I brushed this morning, why are people complaining that I have bad breath? Well, maybe it's because you didn't brush well, and even you do not cultivate the habit of flossing in the daytime. Also, like I said earlier, use gums, okay, to keep the mouth lubricated. Let your mouth not remain dry, okay? Please do not always close your mouth for too long. I'm not advising you to be talkative, but when you close the mouth for too long, the odor just stays there. You know, talk from time to time. Chew sugar-free gums to keep the mouth lubricated and fresh, okay, to give yourself fresh breath. You know, there are some that have minty, strawberry flavors and all of that. Also, drink water. I can't stress hydration enough, guys. Apart from the fact that it does your body good, your kidney and all of that, it also does your mouth good. Imagine, drink enough water. It keeps your mouth lubricated, prevents dry mouth. Guys, if you do this, you will be glad. Even if you have halitosis, I'm sure these practices will reduce it to the barest minimum. If it's a medical condition, of course, you know that you have to visit your dentist. That is the lasting solution for that one. That takes me to the treatment of halitosis. Well, as you have guessed, the treatment depends on the cause. All the prevention tips I've said could be treatment for some people. If you want to treat halitosis that is caused by the kinds of food you eat, you know that you first have to reduce the consumption of those foods to the barest minimum. You know, spicy foods, fishy foods, garlic. Some people believe that they have to eat garlic every day for some kind of health need. Okay, you might have to reduce it instead of taking raw garlic, which some people believe, oh, raw garlic is better than the encapsulated ones. But if it's giving you bad breath, is it worth it that people will now be staying far from you because, oh, the garlic breath is coming? I don't think so. Why not just get garlic capsules, garlic soft gels? There are different strengths if you believe that you want the high concentration. Okay, instead of eating raw garlic every day and smelling somehow, or eating raw onions. You know, your social health is also part of your health. Your mental, your social, your physical. So if you are fine physically, but socially you're not fine, people are staying away from you, you are really not healthy. So consider that, okay? Look at alternatives to those medications that you are taking that may be giving you bad breath. If they can be changed, fine. If they cannot be changed, you know what to do to reduce the effect of bad breath they give you. I've said them earlier. Please listen again. Sometimes to treat your mouth odor or your bad breath, your halitosis, some medications may be recommended, you know, to kill the bacteria that is causing the odor in the first place. Then some mouthwashes are recommended as well. I know we know popular ones. Some people even make it their routine to use mouthwashes every day after brushing, which is a fine idea, okay? But please avoid alcohol-based mouthwashes. Use alcohol-free mouthwashes. It is better for you, because even those alcohols can lead to dry mouth and can cause bad breath in the long run, okay? So visit your dentist regularly, like I've said. Avoid foods that can give you bad breath. Avoid habits that can give you bad breath. Brush regularly. Use very good technique to brush your teeth, okay? Change your toothbrushes, guys. Every 3 to 4 months, you should change your toothbrush. You know those toothbrushes that their mouths are scattered in your house? Please go and throw them away. They have outlived their usefulness. they are not doing anything in helping you to clean your teeth anymore. Change them, okay? Yes, please do that. And once again, listen again to this podcast from the beginning for your benefit. And you see that your relationship with people will improve, your self-esteem will go up, okay? You'll be able to walk into a place with confidence, express yourself without fear of people looking at you a certain kind of way or moving several inches back from you. Yes, guys, and that's what I have for you on today's episode. I hope you've learned a thing or two. So you know what to do now. Yes, share, okay? If you have somebody that has had this bad breath since and you don't know how to tell them, this is your opportunity. Just share this episode, okay? Share it to them. They will believe that, of course, you are helping them to take care of their health. You also have listened to it now, so please share, okay? You are helping somebody and you are helping me as well, because the more you share, the more people listen to the podcast, the more visibility the podcast gets. And don't just share, guys. Please subscribe, follow me on all socials. Everything is in the description of this podcast. I'm on IG, Anti-Pharmacist Podcast. I'm on Facebook, Anti-Pharmacist Podcast. I'm on X, Farm Podcaster. Okay, guys, please follow this podcast, subscribe, and you can leave your comments, your feedback, your questions, your suggestions in my mail at anti-pharmacistpodcast@gmail.com or in my DMs, guys. I'll reply you. Don't worry, I will, and it is well appreciated as well. Please always comment. It's a way of getting feedback for the show and also increasing visibility as well. Thank you so much. I need your support to grow this podcast. I'm on YouTube, yes, and watch out for my video podcast because they are coming out soonest, okay? And please help me subscribe to that YouTube to help me grow it. I'm still here on Spotify and other podcast hosting channels. You know what they are, right? Apple Podcast, Amazon Music, Castbox, and any other podcast hosting channel that you use. For those that think that they have to subscribe to Spotify before they can listen to the podcast, that is not true. Some people will be like, oh, I cannot be subscribing, that's why I'm not listening. You can use your free version of Spotify to access their Anti-Pharmacist Podcast. At the same time, you can listen on the web. Just search Anti-Pharmacist Podcast on Google and it will bring it out. Go on YouTube and search Anti-Pharmacist Podcast. You can listen while doing other things. You can listen on the go, okay? Thank you for your support always. I'll see you next time. Until then, stay healthy and God bless you.